Welcome back. Last session got me thinking that you guys may not be clear on the differences between palliative medicine and hospice.
What differences? Palliative medicine always pushes my patients to go to hospice.
That's not true. Cancer patients are often unaware that their cancer is incurable and they are getting palliative treatment. We set them straight so they can make informed decisions about how they want the time they have left to be spent.
Palliative medicine went to see my patient in the hospital to make recommendations about pain management. The next day, the patient signed on to hospice. I never had a chance to convince him that I had more treatment options for him.
Just yesterday a hospitalist called me to say she asked palliative medicine to see my patient, who was admitted for altered mental status. I had to run over there in the middle of clinic to tell her daughter that I was not ready to give up and that I wouldn't abandon her. If I had waited until the end of the day to run to the bedside, it would have been too late and she would have gone to hospice. My patient died later that day, probably because the palliative medicine physician convinced the family to make her DNR. Patients and their families have the right to know about all treatment options, including the choice to change the focus of care from aggressive disease treatment to comfort care with hospice. My patients don't want to give up. Hospice is giving up. Hospice is a choice that patients deserve to know about. Focusing on quality of life is not giving up. There are studies showing some patients live longer than expected when they go on hospice and their symptoms are well controlled.
I should be the one to discuss hospice with my patients who are not good candidates for more chemo. But I don't want to. Maybe we can work with palliative medicine to put more attention on our patients' goals.